Hey everybody, Dr. Jared Skowron from Spectrum Awakening. We're going to be talking about some more advanced things that you can do to help your child with autism. So we're thinking very big picture here. Now, if you are interested in the specifics and nitty-gritties of these different topics, all right, so what we're going to talk about in general, those other parts of that flower. Now here in the advanced stuff, we're going to be talking about gut work, okay? Do you have good digestion? Do you have any infections? Or do you have good defecation? All right, I wanted to make sure those rhymed. I was pretty happy with myself this morning when I did that. Also, we're going to be talking about mitochondria, all right? So let me back up to gut. Gut symptoms could be change in bowels, constipation, diarrhea, okay? Could be a big bloated belly. Could be a lot of burping or a lot of acid reflux or a lot of GERD. Could be a lot of pain pushing on the belly. As your child push on the belly because it might hurt. Or we've got these kids who have the hyperactive laughter, or the inappropriate laughter is the term, that is often common in kids who have poor gut issues, okay? Because maybe your digestion's not good, causing bowel problems or bloating or reflux. Maybe you have an infection causing pain, causing this laughter. And we got to make sure you're pooping on a regular basis. So, you want to make sure you're not constipated. You don't have diarrhea. You're moving things as you should. Next, mitochondria is a big part of this, part of a lot of our kids. Some of the common symptoms of initial mitochondria are going to be constipation and low muscle tone, hypotonia. Again, what do mitochondria do? They produce energy for every cell of the body, okay? And what uses a lot of energy? The brain, okay? So mitochondria are necessary for development as well as for muscle contraction, okay? We gotta squeeze that poop out with muscular strength. Or you may have motor problems, either gross motor problems or fine motor problems, can't really hold that pen or that crayon and do that kind of thing. Okay. Next, genetics. All right, I love genetics. I want to make sure we get the right genetic testing for you. There's two different genetic tests. You can get a diagnostic genetic test. This diagnoses genetic conditions that mimic autism. That's called a CMA and a WES. All right. You can also get a genetic test about your individuality, things like MTHFR and COMT and detox pathway genes. Okay, that's a genetic SNP test that doesn't really diagnose anything, but it kind of tells you here's who I am and here's my predispositions to different kinds of health issues and how I can intervene. Okay. Then we're going to get into hormones. What symptoms do hormones cause? Problems with behavior, problems with temper, problems with transitions. Okay. Autoimmunity is a big issue. You may have an autoimmune attack against your brain, okay? Your body might be attacking your brain. This can look like pandas and pans. This can be OCD. This can be behaviors. This can be seizures. This can be motor tics, all part of the autoimmune. And then last but not least, we're going to talk about detoxification. And actually next week's Facebook Live is going to be all about detoxification because we are going to be launching our final return of shot support. So our shot support supplement, which we ran out of about 6 months ago and we had a problem with our producer, we finally are gonna have ready for this Thursday, along with a glutathione cream, along with bundling it with our alpha lipoic acid and of course our chlorella binders. We're gonna have all that as a detox bundle, as well as the individual things that you can get, the glutathione cream and our new homeopathic shot support, which I love our new formula. We'll talk about it greater next week. What I've done is I've taken some of the good parts of our old shot support formula and blended it with the cease therapy remedies. Okay, so cease therapy is a name of a specific homeopathic remedies that are used for autism. It was created by a European medical doctor who does a lot of homeopathy. So we've added the cease homeopathic remedies to the good aluminum detox remedies from old shot support, and we got our new shot support, okay? So that should be available next Thursday. We'll have a whole Facebook Live about it next Thursday. All right, so let's get into, again, we're painting broad strokes here, gut issues. What do we want to do to test the gut or to treat the gut, okay? And why does the gut matter? Well, number one, the gut matters because it digests our food, it gives us our nutrients, and it's home to the majority of our probiotics, all right? We have more than 10 times the number of good bacteria in our intestines than we have cells in our body. We need them, and we need the right guys there. Because if the wrong guys are there, if you have a yeast infection, if you have a mold infection, if you have a bacterial infection, if you have a viral infection, if you have a parasite or a worm, all right, you're going to have problems. Problems with pooping, problems with digestion, problems with behavior. Okay, so we're looking at infection. We're also looking at digestive issues, and we want to make sure we're pooping. We want to make sure we don't have any leaky gut. So if you want to check, you want to start with a stool test, okay? Stool tests at most big box labs aren't very good. So if you really want a good stool test, I would recommend either the GI MAP or Genova's GIFX. We have both of those stool tests on our website if you want to get them from us, okay? When you order a lab from us, you order it on our website, the test kit gets shipped to you from the lab, you send it back to the lab, I get the results, I look at the results, I write up a written interpretation and supplement suggestions, send you the results and that written interpretation, okay? So if you want it from us, great. If you want it from your doctor, great, okay? But if you're concerned about gut symptoms, get a stool test. Now, here's some research behind it, and I didn't even get into food elimination. Nobody does well on every food that's out there. Some people do better with certain foods. Some people do better off certain foods, whether that's gluten or dairy or soy or corn or you name it. Different people do well on different diets. In my opinion, there's not one size fits all in this diet stuff. Certain people it's amazing. Certain people it's good. But it's definitely something that everybody should try. And it's a lot of work. I get it. It's a lot of work. I got a 9-year-old. We raised her gluten-free, dairy-free for 6 years. Now she's dairy-free but eating gluten. It's a lot. I get it. Okay? Next, here's a few research studies about, the gut microbiota in autism. We know that there is a connection. Here's another one, autism and gut microbiota issues, gut microbiome, and microbiota are just fancy word for probiotics, okay? Just the good bugs that live in our system. That's it. Gut microbiome is able to communicate with brain activities through microbiota-derived signaling molecules, immune mediators, gut hormones, as well as vagal and spinal afferent neurons. So there is a gut-brain connection, and that occurs of actually triggering nerves that connect, the intestines to the brain, as well as the living organisms in there. Secrete chemicals get absorbed into our bloodstream, circle around, and affect our brain and affect our mood. That's how when you're having a Herxheimer reaction or a die-off reaction, why we get such behavioral problems, because those chemicals that are in the organisms, in the yeast, in the Candida, in the bacteria, get dumped out, released into our bloodstream, hit our brain, and start causing mental changes. Okay. All right, that was a different one. Okay, so that's kind of broad spectrum gut. Again, a lot of our kids have gut issues. A lot of our kids would do well without eating certain inflammatory foods. A lot of our kids do have gut infections, so get a stool test, figure it out, and we can treat it. Next, we get into the mitochondria. Now, mitochondria, big heralding symptoms are constipation and low muscle tone. There are other severe symptoms as mitochondrial problems get worse, okay? But mitochondria produce energy. So we want to make sure that our brain has enough energy to function. So here's a few research studies, abnormalities of mitochondria and autism. This research study summarizes mitochondrial disturbances as a cause for autism-related neurodevelopmental disorders. Here's another one. Mitochondrial dysfunction in autism has certain characteristics such as fatigability, gastrointestinal disorder, unusual types of neurodevelopmental regression, seizures, epilepsy, and motor delay. Now, let me interrupt here. Mitochondrial symptoms have a very broad continuum. So if you have mild mitochondrial problems, you have a few symptoms. If you have big mitochondrial problems, you have a lot of symptoms. I don't like when people will read a total list of symptoms and say, you know what, I have A and B, but I don't have C, D, and E, so this could not be my problem. It might be, but at a mild level, okay? Just because you don't have seizures doesn't mean you don't have mitochondrial problems. You can't rule that out symptomatically because there's mild and severe cases. Okay, here's another one. Critical role of dysfunctional mitochondria in autism, because mitochondria not only provide neurons with energy in the form of ATP to sustain neuron growth, proliferation, and neurodevelopment, but also regulate neuron apoptosis, intracellular calcium homeostasis, reactive oxygen species, and neurons are particularly prone to mitochondrial dysfunction. Dysfunctional mitochondria and dysregulated mitophagy have been closely associated with the onset of autism. All right, so we know that's there. let me interrupt here as a little tangent. I want to talk about different supplements and treatments that we have in our Spectrum Awakening line that could help support these areas, okay? In the gut arena, we have our probiotic gut reset. We have chewable digestive enzymes called chewable digestive enzymes. We also have a gluten digestive enzyme. So if you're trying to be gluten-free, but you're not 100%, you can have this gluten digestive enzyme with gluten that could reduce the reactions. It does that by digesting the gluten molecule before it really hits the intestines, digested in the stomach, okay? Then we've got a bundled treatment that helps kill unwanted organisms. We have an all-in-one supplement called Paraslayer, which tastes gross, so you gotta be able to swallow pills. Then we have something called the yeast mold bundle, which includes biofilm enzymes, different herbs to kill the bugs, and then binders, chlorella binders to get rid of them. Okay. For mitochondria, we have 3 supplements. We have actual ATP. And if you go back to this research study, is this the one? This research study talks about how mitochondria provide neurons with energy in the form of ATP. So ATP is the name of the molecule that mitochondria produce as energy. We actually have ATP in a pill, okay? It's a pill of molecular mitochondrial energy. So you can take that. We also have a mitochondrial cocktail called Spectrum Needs, which is a combination of things like CoQ10 and carnitine, creatine, different B vitamins that we're going to help, okay? That is, sorry, I was looking at a quick question from Insigum about our glutathione cream. So those are the different supplements that you can use to support mitochondrial health. All right, moving on. Genetics. I can't emphasize genetics enough. If you have a child who is a non-responder, hasn't changed with any of these treatments that are out there, if you have a child that you feel was delayed from the beginning and didn't have this obvious regression. Mary just said my daughter's doing amazing on temper tamer with her anxiety and anger and sadness. That's awesome, Mary. I'll get to your full comment in a minute, but I love hearing those stories. So if you have a non-responder, if you have a kid you think was delayed from birth and didn't have this obvious regression of language or eye contact at 12 to 18 months, which is typical, it doesn't have to be at that time, but it's typical, get your genetics done. I cannot emphasize this enough. You can get it, now genetic testing is expensive. You can try to get it from your physician and have insurance pay. If you don't want to bother or your insurance isn't going to cover it, we have the CMA and WES test available. It's a cheek swab, not a blood draw, and we'll get it done. Yeah, you got to pay for it, and yes, it is a lot of money. That's genetic testing, that's what it is, but at least we've got options, okay? The other genetic test you could consider is a SNP test, and again, this does not diagnose conditions, but it looks at genetic individuality, things like mitochondrial genes, things like MTHFR, things like histamine genes, or the gene for Wi-Fi electrosensitivity. There's genetics behind that, okay? And we can look at that through a SNP test. And Sigum says, by the way, Common Cool and anger management together are amazing. That's what I like to hear. We like good work. We like good effects. All right, so here's some, and I see in my patients some cautiousness around genetic testing, because what is this really going to do for me? It might give you a why. It might answer the question for why. Why is my child on the spectrum? Why not these other kids? Okay, what's going on with my child? It might give you that answer. And 70% of genetic conditions that cause autism are treatable based on a study from Harvard, okay? So it's going to potentially get us new treatments and give you a why. Or just rule it out. Be like, look, I did my genetic testing. My kid does not have a genetic condition. This is great, all right? Here's some research. And this research, sorry about that. This research from about 10 years ago, de novo mutations revealed by whole exome sequence are strongly associated with autism. The highly disruptive de novo mutations in brain-expressed genes are associated with autism spectrum disorder and carry large effects. Now, let me highlight one word here, which is the word de novo, okay? De novo is the Latin term for new, all right? And a lot of my patients, when I talk about genetic testing, will say, I don't have autism. My husband doesn't have autism. Nobody in my family has autism. This could not be genetic, all right? Yes, it still could, because there's 2 ways to get a genetic condition. A, you inherit it, okay? I have, this condition, and I have hemochromatosis or thalassemia, and my child does, because I passed down those genetics, all right? That can happen, but In autism, what we're seeing more is something called a de novo mutation, a new mutation. What that means is at conception, here's the sperm and here's the egg, boop, and then the DNA of the two blend, and sometimes when they blend, something goes wrong. So what you get is a mutation in your DNA as the sperm meets the egg. It's a brand new, it's a de novo mutation that none of the parents have, but the child does, okay? So thinking that there's nobody in my family with autism, I should not do genetic testing, it really doesn't matter. It matters because a lot of these genetic conditions we're seeing are brand new, causing autism. Okay, why are they brand new? I think it has to do with a lot of toxicity in the world. That's hypothetical, but we still got to test, okay? This is exome sequence of 457 families, provides evidence for autism risk genes. This is the SPARK group that found significant contributors to autism in 10% of families without previous genetic findings. And again, this is a great highlight because that statistic matches with my practice. We've got families with good, clean genetics, but 10% of our kids have gene mutations. Okay, and those gene mutations are de novo, brand new, not inherited. Okay, next. Large-scale exome sequencing and functional changes in the neurobiology of autism. This was the largest exome sequencing study of autism with over almost 12,000 kids with autism. They identified 102 risk genes. 49 of them show higher frequencing of disruption as de novo variants. These are brand new that cause severe neurodevelopmental delay. Okay, so again, I'm just trying to highlight the fact that your child might have been born with bad genes that were not inherited, but occurred when sperm met egg. That's a de novo mutation, and if you don't test, you don't know, okay? So again, genetic testing does get expensive. Try to get it from your physician, order it on our website. Ours is a cheek swab, usually it's a blood draw, but get it done so you can figure this piece of the puzzle out, all right? Next, how are we doing here? What's next? Let's get into hormones. I'll go over hormones briefly. Hormones include behavior problems, temper tantrums, and transitional anxiety. When I say hormones, most people think sex hormones, testosterone, estrogen, progesterone, okay? I'm also talking about thyroid hormone, and I'm also talking about cortisol hormone. So thyroid you should check because there are some cases of hypothyroidism, slow thyroid, that do contribute to developmental delays. So if you can test your thyroid and you're hypothyroid, just take thyroid medication and it all goes away. It's so cool. When you need it, it's amazing. A very small percentage of kids, but you gotta rule it out, okay? That's a typical thyroid blood draw with your regular lab. Next, let's talk about the cortisol. Cortisol is a big, big thing for our mood and behavior. If you are walking on eggshells, if your child, one little thing is gonna set them off, okay? If they have transitional anxiety, they often will have cortisol hormone problems, all right? Try our temper tamer supplement, which somebody just talked about, helping them dramatically. Also try our pregnenolone supplement. All right, and our pregnenolone, I would go low dose with young kids, like one tablet in the morning. But if you have a kid who is a teenager or a preteen, pregnenolone is amazing for that preteen behaviors, okay? Because cortisol levels drop during pre-puberty and puberty. The pregnenolone and the temper tamer support that. All right, so you can get it tested. You can get it treated. It works. In fact, I just had somebody in my office with neurotypical ADHD, but with ODD, oppositional defiance symptoms. It tested the cortisol. Cortisol's in the tank. It's super low. Give them temper tamer. Give them pregnenolone. Huge, quick changes to behaviors. All right. Round in the corner here, everybody. Let's wrap up with autoimmune because next week we're going to be talking in depth about detoxification with the new release of our new shot support supplement and glutathione cream, etc. I saw little tagline. I saw somebody mention on here that they ordered the old glutathione that we had up last month. We don't anymore. We had an oral glutathione supplement that unfortunately had an ingredient sourced from dairy. Now, it wasn't casein, it wasn't lactose, it was lactoferrin, which is also present in breast milk. But we took it off our website because it is from dairy, and we've got another, we've got a cream in the line. But for those, I've had a couple people, and somebody just asked a question, that glutathione was working really well for their child. Where can I get it? Because we don't have it on our website anymore. This is the box that they got. Liposomal glutathione. It's from a company called Formline Performance. So what I would do is, Google Formline Performance. If you really want this stuff, We distributed it for a month. We don't anymore. We're not going to, but look up Formline Performance, see if you can find it. It's a really well-produced glutathione supplement that has a good shelf life. And that's my big concern about glutathione supplements is the shelf life. All right. Let's wrap up with autoimmunity. All right, autoimmunity. That's pandas, that's PANS, that's OCD, behaviors, seizures, tics, okay? Here is the big clinical question, all right? This will tell you if you have autoimmune issues or not. A, does your child get bad behaviors after a cold or a flu? What is their behavior like after a cold or a flu? Because there's a lot of inflammation going on. That's going to ramp up any kind of autoimmune attack in the brain and cause a lot of problems. All right. Number 2, how does your child respond to ibuprofen? Ibuprofen is an anti-inflammatory. If you have behavioral problems, try a dose of ibuprofen appropriate for their weight and see what their behaviors do. If their behaviors have huge improvement on 1 dose of ibuprofen, we know it's inflammatory. We know it's probably autoimmune. Okay. So that's what we want to get into, all right? How do we test for it? It's kind of tough to test. You know, there are different antibody tests for the brain and for neurons. The tests are not 100%, but they're out there. What I would do is just try to treat it, okay? And that is going to be, in my opinion, I like to use our Panda Bear supplement. Our Panda Bear supplement is an active ingredient called PEA, palmitoyl ethanolamide. Works great, a lot of good research, which I'll show you. I would also highly consider an antiviral, okay? We've got a new antiviral supplement called Viragon because a lot of our kids have symptoms after a viral infections. Now, quick question here from Pat I want to answer. What does it mean when an autistic child gets normal with a fever, all right? So this is kind of the opposite to pandas or PANS, where a fever causes problems in pandas or PANS and autoimmune. A fever helping someone be normal, in my opinion, means chronic viral infection or a tick-borne illness like Lyme or Anaplasma or Bartonella or Ehrlichia, etc. So if a fever helps your child, I would go down that road of antivirals like our Viragon and our Panda Bear, or getting some Lyme tested, okay? And a couple weeks ago, we had a great Facebook interview with Dr. Darren Ingalls, who specializes in Lyme with autism. So go back and watch that if you're interested. All right, a few more research studies and we'll wrap up with some questions. Autism spectrum disorders secondary to a viral encephalitis. Now, encephalitis is a fancy word for brain inflammation. This is brain inflammation caused by, I'm going to be showing you research studies of brain inflammation caused by a virus that has symptoms of autism. Let's say that again. A viral infection that causes brain inflammation that causes symptoms of autism, okay? Could many of our children with autism be a chronic viral infection? It's a consideration, everybody. All right, here we go. Autism secondary to viral encephalitis. This is a case study of a 32-month-old patient with viral encephalitis, marked developmental regression, autistic features, persistent stereotypies, anaphasia. Clinical improvement was mild, and developmental deficits were noticed at follow-up. Viral central nervous system infections in early childhood have been associated with autism, okay? And this case report is significant in presenting a case of neurodevelopmental regression with autism and loss of language. So again, it's just a case study, but it's talking about loss of language and autistic regression with a viral brain infection. Here's another one, okay? You know when we started knowing about this stuff? How about 1999? Back in the 20th century, autistic subjects with comorbid epilepsy, a possible association with viral infections. The annual birth pattern of subjects with comorbid epilepsy has the seasonality of viral meningitis. These findings support the role of viral central nervous system infections in the causality of this disorder, being epilepsy with autism. Is that just a viral infection that the body hasn't kicked out yet? Maybe. I want you to try our Viragon supplement. And don't forget, I'll say it now, I want you to try our stuff. Okay, this is the stuff I use in my practice. This is the stuff that I use in my patients. It doesn't work for everybody. Nothing works for everybody. We know that, okay? That's why we got a 30-day return policy. I would rather you try something it doesn't work, your kid doesn't like the taste, you change your mind, you got a month to send it back and get a refund, because I want to encourage you guys to try stuff, because try stuff and see if it works. Okay, it doesn't work, send it back. Honestly, I want you to try things. That's why we got this 30-day return policy. Next. Okay, it's not 1999, but it's 2002, 20 years ago. This is autistic symptoms following herpes brain inflammation. This is a case study of an 11-year-old youngster who developed the symptoms of autism following an episode of herpes encephalitis. Okay, one more. Here's another case study. And what, 1980? Does that say 89? It said 1989. Holy cow! What was I barely in high school? Case study of cognitive and behavioral deficits and temporal lobe damage. Temporal lobe, that's on the side. Temporal lobe of the brain is on the side. That's where the language center is. The language center is on the side of the brain. Herpes encephalitis, temporal lobe damage. This case study illustrates the highly significant language difficulty, marked memory deficits, and propensity for physical aggression brought on by herpes encephalitis. Okay? Try a viral. Try an antiviral. Try Viragon. Okay? It could help. All right, last but not least, wrapping up on autoimmune treatments. I love PEA, palmital ethanolamide. That's our Panda Bear supplement, which is a tasteless powder. You do have to mix it in food. It does not dissolve in water. It's fat soluble. Mix it in some kind of food. Palmital ethanolamide as an adjunctive therapy for autism. PEA has significant therapeutic effects related to irritability and hyperactivity. Here's another one, beneficial effects of palmital ethanolamide on language, cognition, and behaviors, rapid improvements in cognition, behaviors, and sociability in that case study. And last but not least, palmital ethanolamide and its behavioral correlates to autism, modulation of the immune response, neuroinflammation, neurotrophy, apoptosis, neurogenesis, neuroplasticity, neurodegeneration, mitochondrial function, and microbiome activity, just with PEA. All right. Phew, that was a lot. So let's touch base with a little summary, and we'll get into the Q&A. I don't even know what time it is. My clock stopped working. Keep replacing the battery twice a week, the battery. All right, let's step back and summarize. We want to help our kids, okay, but what do I do? Where do I start? Where do I go? You're brand new to this, or you've been doing this forever, or you're somewhere in the middle, okay? Here's how I work with my patients. And if you're in the beginning, okay, healthy nutrition. If you're not doing a lot of fruits and vegetables, get a multivitamin, multimineral. If you're not eating healthy fats, get an omega or a fish oil. If you're not eating a good fiber, get a prebiotic, all right? You want to start somewhere with supplements. Where I start my patients is with balancing brain chemistry, which is the Skowron solution, okay? Now, that's just the beginning. There's a lot more to do, okay? You hear a lot out there about treating the gut and Candida and diets. Yeah, that's a really good thing to do. I don't start there in my practice because the supplements for brain chemistry work faster than diet, faster than Candida treatments. So I start there because you can get some improvement and relief in behaviors and language and sleep first while we go down this gut road, okay? I'm not saying you shouldn't do it. I'm saying, maybe we can change the order of things to make your life easier. Next, the gut treatments, the food, the diet, the stool tests, the killing the bugs, mitochondria, if you got low muscle tone, constipation, you want to treat that. Genetics, if you think you've got a kid who's non-responder, if you've got a kid who you don't think developed from the beginning of it. CMA and WES, if you just want to check MTHFR and stuff like that, do a SNP test, okay? You can get all these tests on our website or your physician. Hormones, look at that cortisol, look at that thyroid. If they are in puberty, look at testosterone, estrogen, progesterone, okay? It's gonna help behavior, temper, and transitions. You might have autoimmune, maybe pandas, maybe PANS, maybe Lyme disease, okay? OCD, different behaviors, different seizures, different tics. Try the PEA, try an antiviral like our Viragon, okay? There's a lot of antiviral supplements out there, but we want to give you something.